The next principle is maintaining a clean field. Why is it important to maintain a clean field? If the mouth or the operating area is filled with saliva or the blood, I'll not be able to see the calculus. So if I have to see the calculus, the area has to be clean. So this can be achieved by using cotton. Second place, cotton over here so that it absorbs the saliva, or I can use saliva ejectors like this again so that it sucks off all the saliva and the area is clean. And also intermittently we can use cotton to wipe the blood. Bleeding is inevitable many a times when the gingiva is inflamed and when we do the scaling. But if the blood covers the calculus, we'll not be able to see the calculus and we'll end up not removing the calculus. So we can wipe, open please, wipe the tooth surface covered by blood with the cotton so that we'll be able to visualize better. Also, if there is lot of saliva, I'll not be able to establish my finger rest. My hands may be slippery, or I'll not be able to hold the instrument correctly, and I may either injure myself or injure the patient. So always make sure that the operating area is clean and dry.